Well, good morning. I'm here with our Health Director, Denise Fair, to talk about the next phase of the battle against COVID. And as a city, we've had a real simple goal. That's every Detroiter who wants to act to protect your health, the city of Detroit is going to be there for you. We're going to make sure that if you want to take the steps you need to stay safe from COVID, we are going to be the city that gives you the most support, and we will be continuing that effort here. When this first hit more than a year ago, we led the way with the testing site at the fairgrounds. And last January, when people in other places were scrambling to get vaccinated and waiting in line for hours, you could make an appointment and get in a day or two at the TCF Center. Now we have the next phase, which is the third shot. And I want to explain what it is and how it's going to work, because we are again going to take the lead. On Thursday, the FDA approved a third shot for folks in this country that have a deficient immune system. On Friday, the CDC approved it, and today we are rolling out that third shot. I'm going to show you what it is, how it works, and if you want it, how you can readily get it in the city of Detroit. So let's start with, why did the FDA and the CDC authorize the third shot? And this is for the Pfizer and Moderna vaccines for people who are immunocompromised. Let me show you why they did it. The record has been remarkable. Pfizer and Moderna vaccines are going to go down as some of the great medical achievements in history. And they've had up to 96% protection from getting COVID. It has been remarkable. I have yet to meet anybody who regrets having gotten the vaccine, although I've certainly met a lot of people who regret having waited too long. But 160 million Americans have gotten it, more than 5 million in the state of Michigan. We know a lot more about this vaccine. People are getting it. They're not having any significant side effects, and they are dramatically safer. But remember, we're in the early stages. People really only got shots starting in December and not at scale until January. So we are basically at this point 8 months in for seeing how they work. And so we're going to continue to learn together. And as the FDA and the CDC get information, they're going to update recommendations, and this is what they did in Thursday and Friday. And here's why. Pfizer did a study that showed that while they start off at 96%, the effectiveness of the vaccine, the antibodies, starts to drop over time. Didn't know that until we started to get into June, July, August, and you could see after 6, 7, 8 months how it was working. Now, in any other circumstance, 84% effectiveness would be a cause for major celebration, and it is. But we don't know what's going to happen at 10 months, 11 months, 12 months. We aren't there yet, but the trajectory is a little bit concerning. So let me make this in the simplest layperson's terms, and you ought to talk to your doctor about this, but if you're at 96% effectiveness and you got the shot, there's only a 1 in 25 chance that you're going to get the COVID vaccine, the COVID infection, from an exposure. It's been really remarkable. So a 1 in 25 chance, I think everybody would say, is extraordinary. But when you drop down to 84%, now you've got more than a 1 in 7 chance of getting it. And so this is what you're looking at, that I went from a 1 in 25 chance to less than a 1 in 7 chance in 6 months. We don't know what it'll be in 9 and 10 months because we aren't there yet. But you can see that while this vaccine starts off extremely effective, it reduces. And there's every reason to believe the Moderna vaccine is going to have the same results. So here's what the FDA and the CDC did last week. They said, there's a couple of things we want to know. First is the good news. Even though you drop down to 84%, the protection against serious COVID remains very high. There's very little hospitalization. So while you are more likely to get it, you are not at all likely to end up hospitalized or worse. And so if you look at what's happening in America today, all the stories you've seen on the national news in the South of the hospitals being filled, 95 to 98% of all Americans hospitalized for COVID in the United States today were not vaccinated. So while as this vaccine weakens, you're lowered a little bit, it does not appear it is causing you to be more likely to be hospitalized. That's the good news. You continue to have good protection against serious COVID. Here's the bad news, is that even with a mild case of COVID, you have symptoms and you can transmit the disease to others, which means if you're those 1 out of 6 or 7 who has it, you can spread it to others, and you could be spreading it to your friends, to your family, even though you have been vaccinated. And what's worse, and what drove the FDA and the CDC, is that the people who have been vaccinated, who are hospitalized or die, are overwhelmingly people who had a compromised immune system in the first place. And so what the federal regulatory agencies said was, we have to act. The people who did the right thing, went and got their vaccines up front to take care of their health. If you've got a weakened immune system, we need to be there for you to make sure you continue to be protected. And I think what the Biden administration did on this was outstanding. They moved quickly. There's 3 or 4 other countries doing the same thing. Many of the European countries that were the early adopters are finding the same thing that we're finding here, that the vaccine starts to weaken over time, and are also either supplementing with a 3rd shot or in the process of doing that. But I am very happy to see they move this quickly. I've gotten phone calls from people who have gotten an organ transplant, are on arthritis medication, and have their immune system reduced, saying, and these are folks you see have been vaccinated, a lot of times are wearing masks. That's good judgment on their part, because even though it's a very low chance you get COVID, if you get it and you have a compromised immune system, the consequences can be tragic. So, tomorrow, we are reopening the TCF Center for folks who got the Pfizer or Moderna shots before and want a 3rd shot. And the vast majority of people in Detroit who have been vaccinated, there's more than 225,000 been vaccinated, vast majority got their shots at the TCF Center earlier this year. This is going to be a very familiar process for you. We're going to do it exactly the same way you got your first 2 shots. So you can call right now, same phone number we've used for the last year, 313-230-0505, make an appointment. You can get an appointment tomorrow, Wednesday, Thursday, just like before. You will drive up, go through TCF exactly the same way, get your 3rd shot, and your immune system will be dramatically enhanced. You'll get the 3rd dose of what you got originally. If you got 2 Modernas before, you'll get a 3rd Moderna. If you got 2 Pfizers before, you'll get a 3rd Pfizer. Johnson & Johnson at this point is not approved for supplemental shots. That's still being analyzed. But the vast majority of Detroiters got Moderna or Pfizer. And so when you come in, you'll get a 3rd dose of that same shot. And at this point, it appears the 2 are so interchangeable that the federal regulators have said you could get a 3rd shot of the other one. But we have 30,000 doses of Pfizer and Moderna on hand. We have the ability to give you the 3rd shot of what you got the first time, and that's the best standard. That's what we're going to do. You don't need a prescription from your doctor. And this is an interesting thing that the CDC and the FDA did. They are not requiring a letter from the doctor or a prescription. They want to make this as bureaucracy-free as possible. So if you call us up and say your immune system is compromised and you want the 3rd shot, we will book that 3rd shot. Nobody's going to ask you for your prescription pill bottle. Nobody's going to ask you from a letter for your doctor. You know what your situation with your immune system is, and if you're not sure, just phone your primary care doctor. Anybody who's got a compromised immune system should have a primary care physician now. If you don't, you go to the city website, because we have a number of primary care doctors taking new patients. But the vast majority of folks who have these conditions have a primary care doctor. Just don't hesitate. Pick up the phone and call and say, hey, should I call the TCF Center and get my 3rd shot? And you will be able to get the advice that you need. But we will be there for you if you want it. The $50 Good Neighbor program is still in place. So if somebody drives you to the site, they will get a $50 gift card just like we did before. So if you have been a good neighbor and you want to take somebody in for a third shot, you still get that $50 gift card. Everything is going to be just the way that you remember it. You just go back for a third trip. And finally, in the next week or so, we wanted to get this up and running today, but we will be adding more sites. We will be adding home visits in the next week or so. But at least today, I know there are some people who have been very anxious to get this third shot, and we wanted to make sure we could get this up and running right away. And I would say in the next week, you're going to see announcements on other locations, and also we started home visits a few months in last spring, and we will also start home visits for the third shots as well. What the FDA and the CDC say is this is appropriate for people severely or moderately immunocompromised. We're not here to give you medical advice. You ought to call your doctor on that. But typically, what the CDC and the FDA talk about, if you got an organ transplant, of course, you're on those kinds of drugs. You may have a disease affecting your immune system. You may be taking medications that affect your immune system, or your body just may have hit the point where you're not fighting off disease as well. If for any of those reasons you're severely or moderately immunocompromised, you are now approved for the third shot. And again, I will keep saying this, we're not here to make that medical decision for you. We're here with the shot if that's what you believe and your doctor believes is best for you. And so we'll be there for you if you want us to be. Now, I want to take a minute and talk about why this is even necessary. And the reason is very simple. It's the unvaccinated people in this country. There is an enormous river of COVID transmission among the unvaccinated. And unfortunately, it allows for things like the Delta variant. And who knows if we get another variant, because if this keeps spreading, it's a matter of time before this virus mutates, and we're talking about a different kind of variant. And we will again say the best thing that you can do for yourself and your friends and family is to get vaccinated. And I want to talk about what is happening in the country and what it means for Detroit. Anybody who's watching the nightly news is seeing what's happened in the South. And I ran a hospital system for years. And the flu season tends to hit the South earlier in the summer when people are indoors and exchanging air, and it tends to hit our area in November, December, January when we're indoors and exchanging the indoor air. And that's a general cycle that we've seen. And so in the middle of June, this is the New York Times hotspot map. Red is the highest infection areas, then to orange, then to yellow. This is how the country looked in the middle of June. And then this is how it looked by the middle of July. Look at how the red has spread throughout those southern states. And here is the way it looks today. This is this morning's New York Times COVID map. And if you look at the map, it is now spread through southern Illinois and into southern Indiana. That's today. You can see the direction it is going. It is a matter of time until it hits Ohio, Michigan, Minnesota, Wisconsin. I don't know if that's September, October, November, but if you look at the pattern of what's happened over and over, there is a good degree of likelihood that Florida's July could be Michigan's November. And that's what we all have to prepare for. And if you haven't been watching, it's pretty troubling. In Florida, they're having to ship ventilators down there. One church in Jacksonville had 7 members of their congregation die in the last couple of weeks. And this is happening across the South. In Louisiana, their intensive care units are filled with children because the adults are now spreading this to the kids. And it's a heartbreaking story. In one of these cities, they said, we're not going to have a spot in the intensive care unit for your child until one of the children in there dies. These are heartbreaking situations. And now in Missouri, the same thing. The intensive care units for the kids are being overloaded, something we did not see in the earlier waves, what we are seeing now with the Delta variant. And of course, you've seen the story over and over of when somebody is about to be put under so they can be put on a ventilator and let the machine breathe for them, and they don't know as they're being put under whether they're ever going to wake up. And as they're saying goodbye to their loved ones, they're asking, can I still get the vaccine? Well, you can't get the vaccine after your body's overrun with the virus. You have to get it ahead of time to build up the antibodies to stop the virus in the first place. This is the South today. If the past patterns are any indication, this is going to be Michigan in a matter of weeks or months. And so this is preventable by getting vaccinated. So we have 10 walk-in centers, 7 days a week options. The pharmacies in this city and a number of the others are providing them. You can walk in and get your vaccine today. And I would say to you, don't wait until Michigan is a red state and the hospitals are filling up. Because remember, the first shot is okay. The second shot, Pfizer 3 weeks later or Moderna 4 weeks later, provides you full protection another 10 days after that. So from the time you walk in for your first shot, you're 5 to 6 weeks from full protection, which means if you walk in today, you're not going to be fully protected till late September. And if you look at the trend of where this is going, you don't want to go in and get your shot in late September and say, oh, I guess it's real. Turn on the TV and watch what's happening in the South right now. And please, if you've got somebody in your life that's on the fence, they care about, get them in and get the vaccine. I'm telling you, nobody regrets having gotten the vaccine. There's going to be a lot of regret in this state before the end of this year if we don't act more decisively. And if you look at what's happened in Florida and Texas and Louisiana, they're basically 50% vaccinated. The city of Detroit today is 42% vaccinated. There's no reason to think it's going to be any different when it hits here. Now, you got Washtenaw County, Oakland County at 70% vaccination. They've just done an outstanding job, and they're likely to be quite a bit more protected, but this whole state is going to be at risk before much longer, and I'm really pleased that the governor on Friday moved so decisively to make sure that the vaccines are available right away in the nursing homes to anybody that is eligible, because we've watched how that has been in early spreading location. And I think the governor and Dr. Khaldun it just did exactly the right thing Friday afternoon to get us started. So we're saying to you today, don't wait until COVID spreads to get vaccinated. If you're not vaccinated, get vaccinated now. If you feel like your immune system is compromised and you want that third shot, call today, get an appointment tomorrow, and be safe. And with that, I'll turn it over to our outstanding health director, Denise Fair.
Thank you, Mr. Mayor, and good morning. Detroit is experiencing an increase in hospitalizations and also cases. 42% of Detroiters have received the vaccine, but I am really concerned for those who haven't. They remain unprotected. They are unsafe. And if we had more people to get the vaccine, we would get to community immunity, which is 70% of the community getting the vaccine, so we all could be protected. The risk level of transmission of COVID-19, according to the CDC, has increased in the city of Detroit from moderate to substantial, and I imagine by next week will be to the high level of risk. So I do want to remind all Detroiters to continue to take every precaution to stay safe, and the best thing that you can do is to get vaccinated if you haven't already done so. These life-saving vaccines are the best tool that we have to protect us against COVID-19. If you do have a compromised immune system, I do encourage you to get your third shot of either Moderna or Pfizer. Call us right now at 313-230-0505 to schedule your appointment at the TCF Center. We are also offering vaccinations at multiple sites across the city for your first dose, and also in your home. We will come directly to you. If you are experiencing symptoms, we're encouraging you to stay home, but also get tested. And you can get tested at the Joseph Walker Williams Center. It is important more than ever now that everyone, including those who are fully vaccinated, to wear your mask when you are indoors, when you are in a public indoor setting. That it's really important to curb the spread of COVID-19. So please do wear your mask when you are in an indoor public setting. Maintain social distancing and make sure you are taking all the precautions that you know have been effective since the beginning of this pandemic almost 18 months ago. So we can beat this. Just please make sure you get vaccinated, and please give us a call today to schedule your appointment. And with that, I'll turn it back over to the mayor.
All right, any questions? Yes.
Hi, Mr. Mayor. Grant Herms from Channel 4. Has there been any talk of a mask mandate or a proof of vaccination requirement in Detroit the way that there's been in New Orleans or New York?
No, that's up to the state of Michigan.
Thanks.
Anything else? All right, thank you all very much.